So diving into the issue of being quarantined as an ordinary person, I would like to know what the process is like.
Isolation and quarantine, it sounds like the same thing, but it's not. Isolation is for somebody who's infected. If I'm infected, currently our protocol that we will be placed in the designated hospital. It's a major designated hospital. For the Klang Valley, it's going to be HKL and Hospital Sungai Buloh. And we'll be kept there and looked after. If we are sick, we are treated. And once we have become afebrile, normally we'll do a swab. And if 2 swabs taken 24 hours apart is negative, then we are cleared to be released. Quarantine are for contacts. So if I'm infected, let's say my wife would be my contact. So she'll be quarantined. Now, she doesn't need to be in the hospital. If she's got a home, she'll be probably kept in the house. The public health people would monitor her movements, either occasionally visits, or most times it's via phone to see how she's doing. If the contacts suddenly have symptoms, then he'll be taken to the hospital to be swabbed to see whether he truly got infected. If not, after 14 days and you're totally asymptomatic, you're well, you're released from quarantine.
Well, let's say I'm in quarantine. Can I escape? Like, how enforceable is it? Like, can I just...
So that's the Infectious Disease Act, for example, and that applies for tuberculosis. If you have proven to be open TB, you cough, and you do not complete your treatment, you run away from treatment, we can apply that Infectious Disease Act to hold you down.
Perhaps a message for our viewers on how they can sort of not catch the virus.
Individually, all of us have a role. Actually, the more important is actually hand hygiene, and it's something we don't think of. If the bugs are on my hand, it is probably okay, but it's when my finger goes to my eye, into my nose, or put things in my mouth. I have a bad habit. I like to put my pen in and suck on my pen when I'm thinking. So we have to train ourselves not to mess around with the face. Ideally, the best way is to wash your hands. Surfaces, common surfaces like this. So this is, if you and I have the virus, this table will be considered contaminated. All right, so wipe down with a hypochlorite wipe or spray, whichever you have. I know some surfaces are easier to wipe. This is not a problem, but if it's linen and cloth, it could be a bit more messy because you can't be changing cloths every time. Surface that are non-porous like this, like plastic, linoleum or whatever, they do not last as long unless there's a big blob of moisture there, like you spit the saliva and it's there, of course it'll be there. If it gets absorbed into the linen, it might survive longer. The other thing is the humidity and temperature. That's why China is always talking about summer, because the colder and the less humid, the higher the risk the virus can live on longer.